Welcome back to Startup Health Now, where we celebrate the entrepreneurs and innovators who are transforming health. My name is Unity Stokes. I'm the co-founder of Startup Health, and today I'm talking with another one of our extraordinary health transformers, Rafael Rodeiro, who is CEO and founder of Ribon Health at ribon.io. Rafael's from Brazil, and he's tackling an area of health innovation that quite honestly doesn't get nearly enough attention, which is where the funding actually comes from to power all of this change. We often think about the technology, the science, the breakthroughs, but the truth is much of the innovation today is fueled by philanthropy. It's fueled by grants. It's fueled by generosity from everyday people. In Rafael's case, he's reimagining employee giving inside nonprofit health systems. Ribon's platform really flips the traditional fundraising model on its head with a reverse matching system for hospital staff. It's really simple. It's mobile first. It's incredibly engaging, and we're going to talk all about it. And it's really something I learned completely new. So excited to share this conversation with the world. We'll get into Rafael's journey from his start in Brasilia, one of the coolest cities, I think, in the world for people who love architecture, to creating an award-winning platform. We're going to learn how he turned skepticism into meaningful partnerships as part of the Startup Health Moonshot community. And we're also going to learn why his approach could reshape how hospitals think about fundraising. So stick around. This is an inspiring conversation with an extraordinary human. Look forward to you all meeting him. Welcome, Rafael. How are you, sir?
I'm good.
Where are you today?
Right now, São Paulo, Brazil.
Sao Paulo, one of the best cities in the world. I love it. That's great.
Have you ever been here?
Yeah, I've been to Sao Paulo many times, and Sao Paulo always blows my mind because how big
It's huge.
It's
massive.
So vast.
25 million people.
Yes, it's one of those cities where once you've been to Sao Paulo, you realize this is a real city. This is a massive, massive place. Are you from Sao Paulo?
No, I'm from Brasilia, and that's why I sometimes I feel São Paulo like a little bit overwhelming. Brasilia, it's kind of Washington, D.C. for Brazil.
But Brasilia is one of the coolest cities in the world. The architecture, everyone should visit Brasilia and see the most amazing architecture in the world. Just a spectacular place. So anyway, but I want to learn about you. Tell me your genesis story. How did you go from Brasilia, now Sao Paulo, to you're a health transformer? We're so honored you're part of the Startup Health family and really building exciting stuff with ribon.io. So we'll talk about that. But I want to start with you. Tell me about your background. Okay. How did you get started? How did you make your way to health innovation?
Okay, let's do it. Let's talk about that. So I was in university. My university was in industrial engineering in Brasilia. It was Brasilia, UNB. It's like the 5th best university in Brazil. And while I was like the graduation stuff, what happened is that I tried to fundraise to local nonprofits with my friends, and we failed. Local fundraising was totally different from what the playbooks were telling us to do. Not only that, but the generation was completely different. Their habits, their routines was not compatible to these standard fundraising strategies. That was the moment that sparked my feeling that, hey, we should try something different to connect people in real causes where they are online. That was, I think, 9 years ago.
Wow.
Combined with my mom, she's Buddhist, with this spirit of altruism and helping others. I think that everything combined pushed me to try to solve how can we reinvent, reimagine fundraising. Yeah,
Well, this is a really interesting topic, and I don't think it gets enough attention, which is fundraising, right?
hmm
You know, it's one of the cycles of innovation is how innovation gets paid for. I know uh, a lot of folks in the health innovation ecosystem care deeply about fundraising and nonprofit health systems. These
yeah,
are expensive operations. These are expensive organizations
yeah,
to run, and so much of the extraordinary work that's done is paid for by different grants and different monies that come in. Um, so let's start with Ribbon. Tell me about Ribbon. What is your mission? What is your vision with Ribbon Health and Ribbon.io?
that's cool. So yeah, on this path of trying to reimagine fundraising, um, I stumbled on the feeling that you feel when you give. Scientists called warm glow effect. It's the good feeling you feel inside your chest when you do something good. And when I was like asking funds, donation from people, and I was like, hey, I'm kind of trying to convince you to do something good, not only for other people, but for also yourself. You're going to feel good. This is all about like the warm glow. I love this book. It's Matteo Ricard from Dalai Lama. It's amazing how your brain and how your body reacts when you help another person. This warm glow feeling, I wanted to everyone experience it. So um, I made a question. Hey, if instead of asking funds for people to give, what if instead of trying to convince, what if I kind of send them money so they can have the experience of giving for free without having to trust me, the starting point. And if they have this feeling, will that spark something else? And that question, um, then like after that, that was this question that made me create the reverse matching gift system
Yeah,
because
explain what that is, because this is a very novel, I think, element to what you've built here at Ribbon. So you
yeah,
call
it
it
is.
reverse matching. What is that?
Okay. Um, I'm going to even to explain inside a hospital, healthcare system, non-profit one, because I think that where the magic comes from. Instead of asking funds from people, instead of they can like download the app and receive tickets, giving tickets. It's just a portion of the funds raised from the foundation of the health system. They receive those tickets for free every day. In a gamification mobile app, they get those tickets every day and they can give to many projects that are listed inside the app and they know the impact they're making. For example, 10 tickets is 2 days of basic health care for a child. You
So
make that choice.
the employees get this app of a
Mhm.
nonprofit health system, and they start to get these daily free tickets that they can then gift or decide how they want to give their tickets
Yep,
to whatever missions within that institution.
you're right. Almost like a vote. So, but like this vote, it feels like a given. And giving is contagious. Altruism is contagious. So what happens down the road? Some of them choose to add extra funds without that boring asking, without that pushing.
Mhm.
Hey, you should give, you should give. No, they give because they learned that giving feels good. And I have to say, reverse matching gift is not the best tactic, strategy to raise the maximum amount of dollars you can from a certain amount of people. It is not. You have other ways to extract the most amount of money. But when you have, but reverse matching gift, I believe, if it's the best, if it's not, was not one of the best, if not the best, to keep a long-term relationship and a small group of people engaged in the long term.
Mm. So you're building a deeper relationship with your employees. Hopefully,
Mhm.
you're inspiring them. They're feeling positive by their giving of these tickets, and then maybe they add to the contributions that the institution's grants are already funding, but maybe they add to that. And
Yep.
you're also kind of deepening that relationship over time, is what I'm hearing you
Yes.
say.
Yes, because when they choose to add more funds, they kind of receive extra votes. And on top of the current votes, the current tickets that they receive. So it adds up and it's inside the same relationship. And they know they are funding tickets for other people as well. So they are paying forward. They're paying forward for people outside the health system, not employees, friends and family, people from the community. So they can also have this feeling as well. So this sparks like it's a chain of people feeling good about the health system locally. And it's a fundraising chain upside down because we are not, instead of asking before, we kind of sending them money and so they can have the feeling. And this, I believe it's more aligned with the altruism concept um, itself. When you understand the altruism concept, where this feeling comes from, trust you need to have, and the good feeling about it, the warm glow effect. I think everything makes sense. But you have to believe. You have to believe that giving feels good to build that.
So you've had some really big backers and or institutions that have really supported this. I know the Gates Foundation and others. Are you only a platform for nonprofit health systems today, or walk us into the future and the primary kind of users or types of organizations that could be using this platform?
Question. So it all started foundations and anyone, anyone could download the app. Later down the road, I understood that, oh, it's a better concept for local and a small, like a closed number of people, such as employees, like employees. That was when a Gates Foundation awarded us as one of the top 10 most innovative giving tools worldwide. So I got this concept and okay, where I'm going to find the most aligned, mission-driven employees, healthcare. So Ribbon right now, we are building what I believe, because we are like laser focused on healthcare systems. What I believe it's the first platform for healthcare systems, tailored for healthcare systems only. So we are laser focused on that. But it's not the only, I believe it's not the only organization that we can support. I don't know, maybe in the future we are going to open to other larger nonprofits as well, such as higher education, other larger nonprofits as well, and other mission-driven organizations. But I believe that's something 3 to 5 years from now.
Well, it certainly makes sense why this is the type of platform that's involved with our health moonshots. What's it been like for you to be involved with our health moonshots and just the concept of collaborative innovation? Obviously, mindset matters to the folks that are in our community. You're one of these types of people that cares deeply about impact. We focus on mission aligned people. as a primary source of what creates the energy around these health moonshots. What's your experience been? What have you learned so far? And we always like to share this with other people that may be off on their own, building on their own, and not had a chance to be a part of a community like what we're building at Startup Health.
Okay, I gotta say, I was skeptical at first about startup health. So I was like, okay, I'm in a very critical moment for Ribbon. I have to be where I have to be. So I started the community, the Moonshot community. We started having those weekly calls, and it was really good about the founder relationship that we started having, and the feedback was all the time laser focused. But I have a story that I like to share because I like examples. I like numbers and real examples. So I was trying to improve my pitch for potential investors, and Steve was there. Other founders was there on the pitch session, on the pitch training session, and I pitched. It was a 4 or 5 minute pitch, and after it, we received an NPS score, and I received a 6.5. Was like, okay, 6.5 is not good enough. I have to improve that. Not only that they give the score, they also give the feedback on how you can improve that. And 2 weeks after, like I was there again, the preach training session. I trained a lot. I tried to improve. I did my best. And again, received a 6.5. I was like, no way. Kind of competitive. So no, 6.5, I can't do that. No, 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 no. I have to improve that. And well, with the help of the methodology that you guys have for the pitch to get embed in ChatGPT and other feedback that you guys provided, I kind of changed the whole pitch, everything. Before that, I asked ChatGPT, "Hey, what's from 0 to 10? What's my grade? What's my score?" He also gave me 6.5.
Yeah.
And also GPT outside startup health, also 6.5. So my pitch was a real solid 6.5 out of 10. No. And I tried to improve it. I iterated until I got a 9.5 from ChatGPT. Okay, now I'm ready. I trained it. I pitched everyone in the training session, and I received a 9.5 from them as well. Only after receiving the 9.5, I told them the whole story, the background story, that ChatGPT gave me the same score. So yeah, and from that, I I joined. I pitched very good angel investor, one of the famous in the US. Happened to got a call with his team, and we joined his program.
Amazing.
So almost there for like getting one of the most famous angel investors in the US investing in our company because I improved my pitch with you guys. So
That's
yeah,
great. That makes me very happy, and I love the collaboration and your persistence, and you know pushing forward. What are one or two of your biggest lessons learned as a founder so far?
as a founder overall.
Yeah, just one of the things I always like to share is what lessons learned, what wisdom that maybe you wish you knew just getting started, that you would pass on to other entrepreneurs or innovators, considering building something or just getting going.
Okay, I think you only hear from those who build it. I think that's one of the main things that reduces a lot of noise, a lot of distractions down the road. And a lot of people look like they built something, have built, but they didn't. A lot of VCs, I have to say. a lot of people inside VCs, venture capitalists. And also, it's harder than you think. If you need, I don't know, any kind of push to be a founder, you're not going to be, it's not going to be a happy path. So I think founders, they have to be discouraged to, potential finds have to be discouraged to start new companies, because the real founders will do no matter what.
You'll do it
So
anyway. Yeah.
yeah,
It's a long journey, I'll tell you, and it's hard and it
it is.
requires persistence, positivity, passion, purpose, all these things. And I love your slogan there in the background. You
Oh
want to
yeah.
read that for us?
Yeah, this is in my background every time. Do good, feel good.
Do good, feel good. Well, cool. Rafael, it's just amazing to have you in our health transformer community at Startup Health and be a part of the health moonshots that we're building. And just really grateful for what you're building at Ribon. Ribon.io is where people find you. So we want to get this out to the world so more health systems can fundraise for the important work that they're doing, and more foundations can fundraise. You know, this is a critical moment because so much of the funding landscape, certainly here in the United States, is changing as it relates
Yes.
to health and health innovation. The institutions are being disrupted. The grant sources are being changed. So I think it's a really important time to be leaning into new innovation, new solutions, and banding together as ecosystems to support the things we all care about. So, Rafael, thank you for everything you're doing.
Thank you, Unity. Thank you so much.
And finally, an invitation to all of the extraordinary health transformers, whether you are a startup, someone building the future of health, or whether you are an investor, funder, or buyer of the solutions out there in the marketplace. This is an invitation to you to join the Startup Health member community. Learn more at startuphealth.com. Look forward to hopefully seeing you soon.